All right, let's get into our first discussion of the day now. Today is World Autism Day, a day set aside by the United Nations to create awareness on autism.
Well, autism is a developmental disability that remains with a person for his or her whole life. Now, this condition affects the brain's functions. The first signs usually appear before a child is 3 years old.
Now, people with autism often find social interaction difficult. They have problems with verbal and non-verbal communication. The World Autism Awareness Day aims to increase people's awareness about people, especially children, with autism.
Well, the day features educational events for teachers, healthcare workers and parents, as well as exhibitions showcasing work created by children with autism.
And it's usually a build-up, a build-up
yes,
to the day, and he's been on from the last week.
March the 26th.
Exactly, and
yeah,
it climaxes today. Now we have joining us from our Abuja studio, the Executive Director, Neurodevelopmental Disorders Rescue Initiative, Dr. Austin Amechi. Dr. Amechi, good morning. It's good to have you join us right now. Now let's begin this way.
Good morning, guys.
Thank
you for
having me.
Thank you very much. Now, when we talk about autism, it seems a little very far away. It seems academic, it seems scientific. Can you break it down? What really constitutes autism so we can understand what this is?
Thank you. I think it's actually a very complex question. But I think the most important way to look at it is that autism is a neurodevelopmental disorder. It is a pervasive disorder, neurodevelopmental in the sense that the development of the brain of people that are living with autism is very, very different. The brain structure, the brain functions are different from those who are not living with autism. Autism is a massive issue. It's very difficult to define it. It's very difficult to say these are the causes of autism. But what you have to see is that there are challenges, characteristics that are very common among individuals living with autism. And as you've said in your introduction, some of these characteristics are issues with effective verbal and non-verbal communications, issues with effective initiation and maintenance of relationships, issues that they have, those who are living with autism, with their thinking process, their appreciation of information are always different from those who are not living with autism. You could see those who are living with autism having a massive interest of what you call a repetitive behavior in certain objects or certain interests that is peculiar to them. So defining autism is actually looking at some of these characteristics, but the most important thing to know is that it is a neurodevelopmental disorder. The brain structures, not just the brain, the whole nervous systems of those who have autism or those who are living with autism appears to be different from those who don't have that. It is not always difficult. It's always difficult to look at people or to look at someone and say, okay, he has an autism. It always has to do with the behavior.
Okay.
You have to, which is why one of the series of how do you diagnose that? Sometimes you look at the behaviors. There's no blood test that you have to do. There's no scan. There's no laboratory test that you say, okay, let me carry out this to know if the child has an autism. No, it always has to do with looking at the behaviors.
And I was about to ask about how to even determine, to diagnose it, because we understand that a baby could have it from maybe 0 to upward, 0 years upward, or even from 1 year. So how easy or difficult is it to diagnose autism in children? Doctor, can
I'm actually not hearing you very well.
Okay. Okay, go ahead.
But I think the first thing you say, how easy it is to find out those who have or those who doesn't have autism. Again, it's an interesting question again. But what you have to know is that looking at statistics and looking at the literatures and researchers, those who have been working in clinical psychologists and the rest of them who are experts in that area, there are some common symptoms that you have to look at, okay? Normally, it tends to manifest within the children around the age of 2 to 3, okay? But the most important thing as a parent, if you're new parents or even the experts, the medical experts will always tell you, you have to look at what they call developmental milestones. There are certain things children are supposed to do or supposed to achieve or supposed to be able to do at a certain age in their life, from first month to 2 months to 3 months to 7 months to 12 months or to 2 years. There are certain things they're supposed to do. So as a parent, it's very, very important that mothers and fathers and obviously these siblings get to understand and appreciate the importance of the developmental milestones, okay? For instance, some of the criteria or some of the symptoms that children or kids that developing autism may have is an inability, for instance, for them to maintain an eye contact. Okay, if you look at developmental milestones, when you look at the age or the months they're supposed to even say daddy or say mommy, if they're not able to do that, then some of those things you have to be watching and thinking, oh, something might be wrong there, okay? Even though, probably let me not get too ahead, but the most important thing is to have an early diagnosis. When, as a parent, as a mother, as a father, you observe that your newborn baby, 1 year old at 2 years.
All right, we seem to be having audio challenges there, but they'll certainly fix that. We've been talking with the Executive Director, Neurodevelopmental Disorders Rescue Initiative, Dr. Austin Amechi. He's talking to us. Currently, what he was talking about has to do with the issue of milestones. You know, when a child is growing, there are some things you expect the child to start identifying and to start exhibiting some characteristics. And by the time that is not coming at certain ages, you know that you have a problem on your hand.
Indeed, and that is why parents have to be very watchful, and that's what he's saying. And many doctors have said many times, because like he just told us, and like he just fashioned out, that milestones are very important for parents to monitor the growth, developmental growth of their children. When it gets to a particular age, is the baby crawling? When the baby gets to a particular age, is the baby forming little words or sounds? And if that is not in place, is the baby maintaining eye contact? Is the baby concentrating on an object for too long or for so little? All this have to be put in place. And the parents, of course, have to be able to note that, to know that the baby is healthy.
We just hope we'll have him back so we can talk about, because there are now. One question I'd like to ask him is the issue of, because he was talking about discovering that at age between 2 and above. Now, before then, is there anything a parent can do to prevent? Because we know there are no vaccines for all of these, but is there anything that a parent can do to prevent any child from having autism if you discover, or maybe you suspect that the child is going to, because at the point of breastfeeding within the 1 year, you discover, or maybe you suspect that the child is going to, because at the point of breastfeeding within the 1 year, the concept of eye contact is very important, and you should be able to notice that the baby is having eye contact
with the mother, which is
exactly.
almost a given.
It's a given, exactly.
Ritual.
All right, I think we have Dr. Austin Amechi back now. Dr. Amechi, we were having audio challenges earlier, but it's good to have you back on. Now, let me ask you this question I had in mind to ask you. Now, we know there are no vaccines for against autism, but is it possible to prevent autism at the age between 0 and 2 that you were talking about, the bracket before you begin to discover the child has some symptom of all of this? Is it possible the parent can do anything of any kind to prevent autism?
Well, it's, again, thank you again for the question. There's nothing a parent can do, there's nothing a mother can do apart from living a decent lifestyle, okay? Because think about it. It's difficult to say there are issues that are causing autism. But we know from research, we know from a couple of neuroscience research that is going on, that genetics is one of the issues that people have said that may be causing autism. There's also some environmental issues. You think about toxins and some substances that's probably, that may have entered the body system where the mother of a child is pregnant. Those are the issues that have been said, so something like that. If a mother, for instance, is drinking alcohol while she's pregnant, some research have said that issues like that can cause neurodevelopmental disorders. It doesn't necessarily mean that those are the causes of autism, but having a decent lifestyle while a mother is pregnant is important. And again, there are also research outcomes that says that when a baby is being born, there also could be instances, for instance, where there's a reduction in oxygen.
Oh, no, not again. It says they've lost the audio of Dr. Austin Amaechi. We'll try to get him back to talk to us more about autism as the world is creating awareness about that mental health challenge in children mostly, and it usually stays with them throughout their lifetime, but could be managed. Yes, that question you were asking really is almost the worry of many parents, and he just told us that it could be what a pregnant woman is exposed to while pregnant, or some of the habits that are not healthy for the baby while pregnant as well, that could put the baby in such a
It was good Dr. Amaechi pointed that out, because the issue of drinking, taking alcohol, smoking, and then exposure to wildfire. You know, if you go to the hinterlands where women are involved with frying gari, for instance, the wildfire, the open fire where they do all of these things, sometimes pregnant women are involved in doing that because you need to keep the family economy going and all of that.
Absolutely.
That exposure is not good for the child, and then, or for the pregnancy. And then they also talk about the issue of radiation. Anywhere you have either those who live under power lines, industrial areas and all of that, and then all these carbon dioxide fumes all over the place, they're also not good for... I was reading up on this, and it is said that in the United States, it costs about $60,000 a year to maintain one of those. It costs the family that amount of money. Now, if you relate that back to Nigeria, I wonder how families...
Are they even getting any kind of support?
Well, what kind of support are they getting? And then even from the family members themselves. Sometimes they lock them up, those who have autism, they lock them up in a certain, because they feel that it's embarrassing for them to, you know, have an autism patient in the house and when visitors come around and all of that. But we need to be able to accept this thing. You know, if it's your child, it's your child.
Absolutely.
And so on.
And from some of the data I went through, I discovered that males are more affected when it comes to autism than females. I hope we get the doctor back to tell us if it's the same in Nigeria, if you see why it's more prevalent among the male children than the female children. And then bringing all this back home, really, how do we manage autism?
I understand we have him back now.
Okay, thank you for joining us again, Dr. Amaechi. We had audio challenges again, so we hope you talk to us more now. Now, how do you manage autistic children, first off?
Very low. I can't hear that.
How do you manage autistic children? Can you hear me now?
Okay,
Wow.
I guess we have to leave it
We
there
have to
now.
leave, just have
We
to.
were talking with the Executive Director,
just have
Neurodevelopmental Disorders Rescue Initiative, Dr. Austin Amechi from our Abuja studio, and he was giving us background to this. There's so many other things we needed to talk about this to enlighten people. Now, the week has been an awareness week, right, from the 26th of March up until today. Today, the 2nd of April is the final day, the climax of all of this, and various activities are supposed to be on during the week to create more awareness. And one of the things is the creation of awareness, the issue of stigmatization, and the issue of care for these people is what the attention should be when it comes to creating awareness, so people can know more about these things. So we have to leave it here now. Thanks for watching. We'll go on a break, and then don't forget, at the top of the hour, we'll be coming back for the news update, and then we go ahead with other topics. Stay with us now.